I am Kemini Amano, and my guest in this edition is himself a medical doctor. He has worked at all levels of healthcare delivery in the country. Today, he is the president's backbone on health policy. He joins us as we assess the successes and shortcomings and what the future holds for healthcare in Ghana. My guest on the program is Dr. Anthony Nsiah Asare. You're welcome to the program, Doc.
Thank you.
Millions of dollars have been sunk into Ghana's health sector. Here we are today, really. At best, would say that the service is good if you can pay for it. But in a lot of cases in the public sector, the healthcare delivery there is really poor. Why is that the case? Where did all that money go?
Thank you very much. You know, health is very expensive. Nobody can say health is very cheap. But health is wealth. And I've always been saying that there's also wealth in health. So you can create wealth from health. And if you are healthy, you are wealthy. A healthy nation is a wealthy nation. So we have to continuously pump. Any amount of money which is pumped into health is not a waste. It's an investment. So you should take health as not as an expenditure. We take it as an investment because you invest on in people's health from the womb right down to the time that he goes back to the grave.
What do we have to show for the millions we have sunk into the health sector?
There's a lot you could show, especially with this present government since January 7, 2017. People have been saying that, how many hospitals have been built since this government came to power? Today I'll give you examples of hospitals which were inherited, which have been completed, and new ones which have started. And most of them are there about 99% stage of completion, and some of also moving on. You see, so we spend a lot of money, you say millions of dollars.
Indeed.
We spend, you know that in 2020, when COVID-19 also came, every country, not only Ghana, also spent a lot of money to make people safe. Remember the very good statement that His Excellency the President made in one of his fellow Ghanaians, that I know how to bring the economy back, but I don't know how to bring a dead body back. So I will make sure that Ghanaians are safe and healthy, and God being so good and good straight to his ways, I think we're one of the best countries that manage COVID-19. I'm not saying it. It was published that we are among the 3 countries who have managed COVID-19 very well. If you look at our case fatality, it was less than 1%. No country had that. People will say that, maybe we are not seeing the people who were having COVID and died and all these things. But I can tell you that during those periods, we didn't see, as we saw in some other countries, where crematoriums and cemeteries were full. It didn't happen.
All right. I want to draw you back to the question of what we have to show.
Yes.
For the millions we sunk into the health sector.
Yes.
And then you mentioned that government has completed some facilities that it has met and starting others from scratch. Yes. Are all these under the Agenda 111?
No.
Okay. Talk to me about these facilities.
VAMED projects. You remember that VAMED is VAMED Engineering Company Limited, started some hospitals, which the previous government started. There were 10 of them, one in Central Region, which they brought in the funds. You see, today I will explain and differentiate between somebody who thought about something, about a project, brings in the fund, goes through a cabinet approval, parliamentary approval, and the money comes, and he starts and finishes. And then you come and meet the money. There's a project ongoing, either you finish it or not. I'll explain all of them here today. And then somebody who also have started from the scratch to completion. So if you look at the VAMED projects, I'll start from there. If you look at the VAMED project are about 7 different types of projects. When we came to power in 2017, there was a project, for example, 10 polyclinics or 10 hospitals. I'll call it smaller hospitals. Some were 15-bed hospital, some were 30-bed hospital in the Central Region at Akomfode, Bimpojiga, Biriwa, Besiase, the Rampong, Ekumfi Nakwa, HC, Sonkwa, Jamara, Macron, and Potsi. We came, the money has been secured, the project has just started, and we completed in 2018.
How many of them? 10, you said?
They were 10.
10.
If you come to Greater Accra region, there was one at Ashaman, at Adenta Obuluju, Botiano, Oduman, and Sege. We started it in 2017, even though the money was, the project money has gone through Parliament and everything. And then we finished in 2019. 5 of them completed, commissioned, and is in use.
I see. And this is what I want to ask you about those facilities.
Yes, I'm coming.
How equipped are these facilities?
They are equipped. They are smaller hospitals, functioning facilities. Workers are there working. Then we came and made a Tamale phase 2 project, which we completed also in 2019 and put to use. And then there was we also started 5 polyclinics construction. How many? 1, 2, 3, 4, 5. That one also started in 2018. That was Weta, Sumenya, Tolon, Sola, Bupi, and Bamboy, which has been completed and in use in 2020. And then this government started another project from VAMED. You continue getting money from them, where we put also hospitals. We built hospitals in Western region, which have been completed and in use now. That is at Akontombra.
Right.
There are 40 beds. These are no more 30 beds hospital or 15 beds, 40 beds. We improved the number of beds so that it can take more patients. So at Akontombra, at Bogoso, at Elubu, at Mpoho, at Takwansaim, and also at Wasa Dunkwao. They've all been completed in 2022 and it's being used as we speak now.
Then, so the point I'm making is that if all of these things have been done, they are functional, then we are not exactly infrastructure deficits. Why did we need Agenda 111?
Yes, thank you very much. During the COVID-19, you remember that patients were being carried from all across the country looking for critical care beds for the patient. We were looking for isolation centers for our patients. Then we asked the Ministry of Health, Ghana Health Service, to do a survey to find out the 216 or 17, how many districts? 216 districts. Districts without hospitals. And it came out that time that 88 of the 216 districts in this country have no semblance of a district hospital, which means there is no primary referral center in such districts. In the rural districts, where there are no private practitioners there, it means there's not a single doctor in those districts. Districts of about 140, 150, 200,000 population. So they have to move to other areas for care. So as a lesson from COVID-19, the president said that we have to provide hospitals across the country for all the districts. That's why the Agenda 111 came in. 88 of them. But we realize that there are some districts which are so far apart that we have to put 2 of the hospitals there. That is the reason why this president and this government
but then again,
came out of Agenda 111.
Then again, we had a lot of money we were investing in infrastructure. We didn't have a map out plan of where we wanted to strategically position these facilities so that people can easily have access to them until COVID-19. Is that what we're saying?
You know, every government has come to add hospitals. I mean, I will not shy away from that. I will not run away from that. It has been continued. But this is the first time that a single government within its terms of office wants to provide the basic primary referral center for all districts. And
so where was the foresight? No, hang on. Before we clap for you, where was the foresight until COVID-19? Which then told you that some districts, 88 districts, didn't have, primary care facilities. Where was the foresight when we were pumping all that money from all of these other projects in determining strategically where to position a facility so that people can have access to it?
That shows boldness on the part of His Excellency the President and this government, that now we are not going to do it in piecemeal. We are going to make sure that every district has a primary referral center. And that was a decision of His Excellency the President, which the cabinet approved, which the government also approved, and that's what we are doing in the Agenda 111. And to me, it's the first of its kind in the whole world, where a government has come and said that I want to provide first the first referral center so that you don't have to move from one district to another district to go and secure this health.
Are there actual timelines associated with this project?
Yes, because you see what we are doing in Agenda 111, you realize that we didn't start all the 111 at the same time. For example, as we speak now, the regional hospital, there's 7 of them. I think it's only 1 which is running because Ministry of Health has a project for Takoradi one. The rest are on hold. We've done the value for money. It's at Ministry of Finance because of the debt restructuring and IMF. So immediately we end the debt restructuring, which I know that's going to be this month ending. The contractors will then complete the negotiations and move to site.
I see.
The other side,
So when do you think that any hospital or facility under the project could be concluded?
In the third quarter of this year, we'll start commissioning some of them.
I see.
Not all of them, because as I said, not all started at the same time.
Is this a review on the dates? Because I think earlier this year, you said second quarter of this year.
You said that by the end of the second quarter, we will be finished.
Yes, but now you are saying by the end of the third quarter.
You see, if you are in construction, as even we are now in the rainy season, maybe you are doing the roads. Some of them are doing the roads and the gutters. If there's too much rain and the place is this, we have to wait for some time for the ground to be there, then we continue. So you can propose that. That's why every construction, we say that this is the estimated time of finishing. Then we move
So
on.
we have reviewed it to third quarter of this year.
Yes, I said from
Is this going to be another partly or perhaps even a failed promise by this administration?
What is the failed promise?
If we don't see it as a failed promise.
Go to the sites and go and see the work which is being done in most of the sites. Some of them are about 90% completed as we speak now.
Okay.
So they are waiting to finish the structures. As we speak also now, we have started the procurement of the equipment which will come in. We finish the evaluation. We will give to the vendors for them to start bringing the procurement, the equipment. So it is a project. It's a huge project. 101 or 102 district hospitals throughout the whole country. Every region has one. The regions which have the least district hospitals are maybe Bono East, Ahafo, and then also the smaller regions, and then Savannah and Northeast. For example, Volta region has 7 of the projects. There are about 3 or 4 of them which are nearing completion.
Nearing completion. So by the end of the third quarter of this year,
yes,
we'll see
some of them
completed projects.
Projects which will be commissioned.
I see.
If you go to Western region, there's one of the projects there which is almost completed. If you go to Ashanti region, about 3 or 4 or 5 of them are being nearing completion. The contractors are working assiduously and very fast so that they can deliver the goods to us. But the most important thing is that the progress, so far as some of us are concerned, is good. There are some of them, because of land size, we have to change the drawing. So they are going to be story buildings instead of the one stack.
I see. So how much? What's the estimation on how much you are spending on the all the facilities
we've said it over and over again.
Now.
Average about 16.8
Well,
million.
times change.
About 16.
The currency exchange. Remember that the currency exchange was blamed for vaccine shortages. So I just wanted to know if we are still on the same budget.
Agenda 111 is dollar rated.
Okay. So
it's $16.8 million for the single stack. It's a double stack which we have to add about $2 or $3 million to it.
Oh, I see.
So
is the La General Hospital 111 project? No. So why haven't we, all the funds that we got for the other hospitals, why haven't we, pumped some into the La General Hospital?
Have you checked if La General Hospital is not working now?
We no, hang on. We know that. No, we've been covering the hospital quite well. We know.
Has it started or not?
Hang on. You see, when you say has it started or not, that is just a partial aspect of the project. It took a long time for contractors to be there to work? Because we've been covering this for a long time, and we know that it's only recently that contractors went back there to cover it. So yes, it has started. But what is the rate? When can the people expect that their hospitals will be back?
When can the people expect that their hospitals will be back? When can Bokoro in Hunter West expect that their hospitals should be back? They are all very important. Every district or every locality needs a safe facility. But one thing is that, you see, people should know, and I want to do this small education. Every project has a source of funding. La Hospital, there was a loan which passed through cabinet to parliament. So it has a different source of funding. So you cannot take, for example, Eurojet money to go and do La. You cannot take VAMED money to go and do La. So now, the Ministry of Finance has sorted La and given them some money to this thing. That's why they are on site. And they are
That's why they are on site now. But it took a lot of time.
Yes, but it's negotiation.
For the workers to go there.
It is negotiation, because we know that for whether we like it or not, there was this debt restructuring, there was IMF. I know that the financiers, also one of the banks became bankrupt after the COVID. And so the other one also withdrew and all sort of things. So it has started. That's the most important thing. And they are working very hard to move it fast forward.
I see.
So that's the most important
thing. But at the pace of work right now, we have had some timelines as by the end of the year. Does it look like...
LA is not part of Agenda 1, which I'm managing. So it's Ministry of Health who can tell you the timelines now, the new revised timelines. But the most important thing I want everybody to understand is that LA has started and is working.
It has started,
yes.
and the pace of work is slow. Some of the workers are already complaining that they are not paid what they are supposed to be paid.
That is the management of the contractor. I cannot speak to it.
But it should be something that interests you if the contractor's behavior is going to delay your project.
Yes, I will ask the Ministry of Health who are managing it. So the other Agenda 1 projects have all started. There are some of them as we speak today. It's not that the land has been cleared. For example, Nima.
I see.
Nima. So it's difficult to get land in Nima. Now we've managed to get a land, and it's going to be a double stack. Medina, the metros, especially Accra Metro and Kumasi Metro, had a lot of difficulty getting 15-acre land. So we have to change the drawing. So that's how it is. The most important thing I'll tell you about Agenda 111 is that we have been going around. It's a project that we have been monitoring very well.
Right.
The chiefs and the people tell us that even the thought of government that we are giving you this district and this town a hospital is even more than enough.
Very well. If we have invested that much in infrastructure and these facilities are up and running, it means that we need human resources for those areas.
Thank you.
Why do we still have nurses and trainees who claim that they are not posted, they don't have jobs? What is going on there?
You see, the system we have in this country, unlike other countries, where there's a very strong private health sector, and there's also the government, the public health sector, which are competing to take the people that we've trained. In our government employs about 90% of our staff. We as a country, in 2005, through the vision of President Kufuor, said that let's increase the number of our training facilities. Let's also have middle level health professionals, especially nurses. You remember that time we had a great shortage of nurses, to extend that we have to, if you were not young and you saw what was happening, we have Kufuor nurses where they were wearing pink. We trained them on the job and this thing. So we started then training what we call the healthcare assistants. That is a nurse assistant clinical, nurse assistant preventive. So we there are a lot of schools now. I think about 95 schools across the country, including private sector.
Okay. We
started training midwives directly. At first, you have to do registered nursing before, after 1 year or so, you go to nursing midwifery training for 1 year. But now we train midwives so that maternal deaths will also go down. So we have a lot of nurses who are being trained. It's government alone who has to employ about 90% of the people. And government works with budget. there are a lot of competing factors also. He has to employ teachers, he has to employ doctors, he has to employ nurses and everything. That's the reason why the employment of people into the health system is a bit slow. But we need all the nurses, we need all the doctors, we need all the pharmacists who have been trained. And if you expand the hospitals, we expand the health infrastructure as we are doing now, then we can then absorb all of them. We've worked all of them out. For Agenda 111, we've worked out the number of staff who will be working in this system. We are negotiating with the Ministry of Finance.
How many of them do you hope to employ?
Per hospital is about 500 staff. So if you multiply by the number of hospitals that you want, that's for the district hospital. For regional hospitals, about 1,300. For the psychiatric hospital, about 550.
Then there will be no joblessness or health worker.
But it all depends on
was it the same mass that you used in employing for the other facilities you have outlined?
Yes. We have.
If it's the same mass, then by now those who have been unemployed for 2 years should have a job now.
We have norms, and the norms tells us the number of people that have to be here. But the problem is that you have your norms, you have the people that you have to put into place, but you have to also get the budgetary allocation. So if the budgetary allocation is not there, then you factor it and then start filling it. So I want to assure all my nephews and nieces and my grandchildren that they will all get job to do. It's patience. So we are also encouraging the private sector to also start employing so that they can then compete with government and then also mop up the people who are in the system who are waiting to be employed. So that's how it is. But Agenda 111 is well thought out, and we know the number of people who will work there. We know how we are going to do it, and the ones that...
And you say a total of how many health workers will be employed in this?
I can give you the figures.
Okay.
For example, district hospital, per district hospital, we need a total of 549 staff, professional staff, and then other staff, which means that if you look at all the district hospitals, about 102 district hospitals that we are putting up, it's about 55,000 or 56,000 people that you have to employ. The regional hospital is 1,343, and they, times the 7 regional hospitals is about 9,345. Psychiatric hospitals 947. So a total of people that we need.
Then we're going to start importing nurses and health workers.
Oh, the nurses, we know the number of nurses that we have to employ.
Let's talk about the brain drain problem that the health sector also faces. Now, we know that one of the things COVID opened our eyes to is the fact that health workers are needed elsewhere. And so we've seen them leave the country in droves. Instead of the government doing something about it, it decided to rather add on to it and signed an MOU with Barbados to export our nurses there. I mean, what was the thinking behind that?
The thinking behind is, I will talk about the brain drain. We are in a free world. For example, you are here. I don't think TV3 or media, what do you call it, Media General, can force you to stay here forever. You even move from one place to another place within the country. The same thing, it's true. COVID-19 has made health professional work not too attractive in the Western world, because they know that a lot of people who died were frontline health workers. I've heard that even the training schools, they find it difficult to get people to go to the training schools. But we have a lot of young people who even want to enter nursing training schools. So the solution to it, to me, is not the unethical way of coming to take people away. We cannot force anybody to stay in your country.
But if the conditions were good, they'll stay.
If the conditions are good, you can stay. But as I said, government employs about 99%. Conditions, if you want to make conditions as attractive as in where they go to, then it means you need a lot of things
attractive enough to make them stay. Yes. Right now, the conditions are poor.
Yes, for everybody in this country.
No, for the health workers.
Yes.
The conditions
and for that matter, for teachers and for any other person. So when you are doing it, you have to also balance it. So that's what government wants to do. We want to put in what are the push factors. I know the push factors. If a young person knows that I'm being posted here, as we speak now, even though people are leaving the country, we are not maybe employing everybody. There are some places where we have very shortage of critical care health professionals. Because if you want me to go to some rural community and I go and there's no accommodation, it becomes difficult for me to stay there. So we have to provide that. And to me, that is where the rural incentives come in. That's what government now is going to do. And we can do this thing with the private sector. Very easy. Because any private sector who has its money and wants to go and put blocks of flats somewhere else can also put it there. And then government then maybe assist to take
No, but
off,
why isn't government doing anything about the conditions that some
government
nurses find?
continuously is doing things about condition. You remember, we've seen this, we've seen brain drain before. We know how to tackle it. We know things which will make, for example, some of us come back. I studied, I did surgery outside. I came back. And when I came back, I think it's okay for me. I mean, I've worked through the system. So people need something, just something soft to be able to stay in your own country. That's the first thing.
Is that something soft
We are working on that.
available?
We are working on that. That's why...
Since when? You have 7 months to go. What really can you do within this period?
Governance is continuous.
Okay.
I don't believe in 7 months to go or 8 months to go. Governance is continuous. And I know we'll come back.
But you've had 7 years to be able to do something soft for them. You didn't do something
Yes,
soft.
we've been doing something soft. We have been doing something because salaries of health workers is not the same as salaries, for example, for civil servants.
Well, salaries are negotiated
Conditions.
hang on. Salaries are negotiated as a whole for public sector workers. So
Yes.
I don't think salaries will be one of those things that we would particularly touch on as doing something soft for health workers or nurses in this country.
It's salaries, it's other conditions like conditions to get yourself upgraded, conditions to, you see, I'll tell you, every young doctor, every young nurse wants to do something extra. Every young doctor, for example, when you finish school, you want to do postgraduate, you want to be a specialist. So it will make that one very easy. That's the reason why we have set up the College of Nursing and the College of Physicians and Surgeons so that you have a straight intake and then go through it. We are trying to even make sure that we decentralize these postgraduate training so that you don't have to wait for a long time to enter any school, anywhere you are, which we started doing for both nurses, doctors, pharmacists, and everything. The next thing is, that the professional who has come out should be able to maybe get some means of transport to go around, which we are working on it. For recently, I think has even been announced that the car waiver, which was taken away, for example, I understand for doctors, which I'm sure they will work it for the other staff, is also being reinstated. We are talking to the new car companies.
It's all being reinstated. None of them have timelines.
I've seen that something is being done. It's done because I saw some forms which I'm not too sure. I have to find out. New car companies here in this country, we are talking to them to see how it become more conducive. If you go outside there, that's what people do. People are on this. And then, to me, first is the rural allowances, which I've spoken about, accommodation, where they will put their head, where they will have also some soft listening for this thing. So these are things that we've sat down, we are working on it and come out very soon with a comprehensive approach to also make their lives very reasonable and also very soft for them.
Doc, when we come back, we'll talk a bit more about the issues related to the health sector and the health workers particularly. Don't go away. Welcome back to Hot Issues. I am Kemini Amano. Today my guest is Dr. Anthony Nsiah Asare. He is Presidential Advisor on Health, and we've been discussing the health sector, obviously. But Doc, thank you so much for your patience. Why does the government have no interest in mental health?
This government has a lot of interest in mental health.
What shows?
Under Agenda 111, for the first time in this country, we are putting 2 mental health facilities, one of them in Tamale, to serve the northern belt, and then one in Onwi, in Ojusu municipality, to serve the middle belt. If you go to Tamale now, it's about 90% completed. It's one of the projects which will be completed as quickly as possible.
So
that is one.
Hang on. I understand that, you have the plan on paper, But the existing
no, we're
ones,
executing the plan on paper.
Until it's completed, we don't have those, mental health facilities. We only have the 3 that exist right now. If you're not doing anything to support the ones that exist right now, yet you're going on to build, you're giving us hope of the 90% complete one?
Well, I don't understand your question.
What have you done for places like the Premier facility, the Accra Psychiatric Hospital?
Accra Psychiatric Hospital is going to be redeveloped. It's part of the ones which are the Ministry of Finance. We are going to pull everything down and redevelop it and re-equip it as a national referral center for psychiatric cases.
When?
I've told you the regional hospitals situation, that immediately the death restructuring is over, contractors will move to site.
Until then, the Accra Psychiatric Hospital is still the way it is, depending on, donations.
Madam, I'm finding it very difficult you see, if you are doing project management,
right,
you start the project, you move on the project. But if you continue saying that, Accra Psychiatric Hospital is the same, I'm telling you the plans that we have for Accra Psychiatric Hospital. It can't happen in one day.
And I'm saying that I understand the plans you have.
Yes.
However, over the 7-year period the administration has been in office, you'd expect that the Accra Psychiatric Hospital will receive a substantial amount of attention, such that it would not be over-reliant on donations as we see.
Yeah, I think government, that psychiatric patients are taken care of, they don't pay anything for free. And who bears the cost? It's government. So I think government is doing everything possible to make sure that mental health services is well taken care of. And now to extend that, we are asking National Health Insurance to even add the cost so that it will not be, they don't have money to buy food. They don't have money to buy this. Because if you go to other hospitals, once you know that you're going to get money from health insurance, you can even go and credit your commodities. So this is some of the plans that the government is doing.
One of the plans that the president had put in his manifesto was to focus on health promotion and prevention as part of primary health care through the National Health Insurance Scheme to achieve universal health coverage. To what extent do you think this has been achieved?
Yes, if you remember, we have, as a part of the health promotion, we have been making sure, and we have done pilot in some of the hospitals in Ghana Health Service. And now I understand that they have expanded it, that every district hospital should do that, where there is a consulting room for medical checks. The only way that people will know that they are hypertensives, they are diabetics, is that at least once a year. For example, Media General, the management should make sure that every worker here goes through a medical check and come and show it.
Right.
I call it adult weighing. So that is one. The second point is that, if you remember, in 2018, Ghana Health Service, we detached the family health, where the health promotion was. So now we have a complete directorate or division of family health division in Ghana Health Service, of a director, deputy directors, and the same thing is throughout the regions, to do health promotion and health education for the citizens. So they need to go around, they need to move around, and then also educate people, which they are doing. So the next thing that we have to do is this free medical services, which they are doing now. And I know that the National Health Insurance Authority has almost completed actuarial studies to see that if anybody who is on National Health Insurance scheme would then have once a year a free medical check.
I see.
Per person. Initially to be expensive.
Who's going to take that cost?
National Health Insurance.
The same National Health Insurance scheme that supposedly is bankrupt, is unable to...
But National Health Insurance is not bankrupt.
It's not?
No. National Health Insurance, we all pay for National Health Insurance if you buy credit. You know why? National Health Insurance levy. So I've always been seeing that.
But is government releasing the funds to the accounts of the authority?
That is what Parliament and government should sit now together, because there's something what we call capping. so that the uncapping will go. And we believe that that should be eventually the case. And health insurance is not bankrupt. So it can take care of this. Initially, as I said, it will be slightly expensive. They are working out which goes into, for example, a woman over 50 years, what will be the test, a man over 50 years, what will be the test, so that from 18 years and above, because children before the age of 5, 6 go for weighing, whether they are sick or not, so that those from 6 to about 18, they all go to school. So every year you're going to school, you also do your medical check.
I mean, Doc, do you know that the National Health Insurance made a very flamboyant promise at the beginning of this month and it's not been able to fulfill? It decided to subsidize a dialysis for patients.
What do you mean by that it has not been able to fulfill?
Because the patients are still paying in full.
Yes, but if you, when did the
it was supposed to take effect June 1st.
Yes.
Today is June 6th.
Yes. So
and patients are still taking...
I'm coming, madam. I find it difficult to accept what you are saying. You make a policy today of effective June 1st. So, and the June 1st was a weekend, isn't it? So Monday was June 3rd.
Indeed.
And I saw yesterday that National Health Insurance Authority Chief Executive went to Kolebu.
Absolutely.
Yes. So if you went there on the 1st, you went there on the 2nd, and you are part of the group, for example, 0 to 18, 60 and above, and then those within, I think, 2 sections.
Yes.
And you have a section, and you pay for it. You are given a receipt. So you go back. The next time you go back, it will be refunded to you.
Is that the plan? Because the patients don't know that.
No, let me tell you, what is the plan? You make a policy here at Media General today. Not everybody will hear about the policy. A letter has to be written and sent to the chief executive. Chief executive have to circulate it. But it means... Has
that letter been written?
Yes, as I know.
Kolebu says that letter hasn't come at the time we checked on the patients.
Yes, but I don't know why you were so... I know that Monday you started checking if the patients are paying. Nobody does that. It will be either somebody goes there or not. You cannot even check it. Because it's people's money. So anything that Kolebu does, anything health insurance does, should be documented. So please, patience. Everybody should be patient. Who falls within that range or that policy, if you have paid money on the 1st or 2nd or 3rd, it will be refunded to you. It's as simple as that.
I see.
So I don't think if you say it's flamboyant and they can't fulfill it, it's fulfilled.
I want to understand.
Yes.
When the patients go there now, they will pay. But you're saying you give them back the money. When?
Immediately that Kolebu brings returns for reimbursement, they will be reimbursed and then the patients will be paid. Because dialysis patients, for example, if it's about 17 years, it goes there at least twice a week.
Do you then fault the kind of communication that was put in the public?
Like what? Like starting from 1st of June?
That, you can walk in and have your 2 services for free.
It didn't say that. What it said was that from 1st of June, I can open it for you.
But I know what it said, because it never mentioned that you will receive a refund. It said when you go there, it is free. You are now given the extra explanation that even if you have paid, you will get your refund.
Yes.
And I'm trying to understand, okay, so when exactly will patients start to get the refunds?
If you ask me that, and I'm telling you that when Kolebu wants to give a refund, they have to refer to a document. Now, I'm sure they've received the letter now.
Okay.
Because no chief executive in Kolebu or administrator in Kolebu and say that go and collect your money. If auditors come, where did you get the letter from? So it's a process. For example, government can make an announcement today, and if there's supposed to be a refund, you don't get the refund immediately the same day.
All right. Then the letter should have been clearer. That's,
No, you don't write in a policy statement. You don't put all those things in a policy statement. So far as I know, over my years of being a manager, is that we are starting this policy from this date. So it means effective 1st of June, anybody who falls within that bracket.
I absolutely understand that.
But you don't add it in the communication. I absolutely
understand that. I'm saying that the communication never talked about refunds. The hospital authorities didn't know about refunds. They said they had not received any communications from the authority or government that they needed to give the services for free.
Which hospital authority did you speak to?
The Kolebu Teaching Hospital.
Which authority?
I don't understand what you mean by also. You want me to give you a name? I can't give you a name.
No, but you know, if you go
but I'm telling you that is what we picked up when we were there.
If you go to Kolebu and there's a policy and you want to know how the policy is working, to get an authentic decision or authentic management decision on it, the best person to talk to is the chief executive, not a nurse.
No.
Not even a manager at that place.
No,
it's the chief executive.
You won't rile me to give up my source, but once you have admitted that indeed a letter needed to be written, and I have said that the letter, as we went there, we were told the letter had not the letter had not arrived.
When did you go there?
I think we are on the same page, right?
Yeah. So
we're on the same page.
The reason why I'm saying that I chaired that committee for National Health Insurance.
Right.
There was a Kolebu chief executive was a member of that committee.
Then we shouldn't be here.
Tamale chief executive was a member of that committee. Cape Coast chief executive was a member of that committee. The president of the Dialysis Patients Association was a member of that committee. So he knows, everybody knows.
Everybody knows.
And we discuss it there. So he was representing the dialysis patients.
Right.
So he has an association, and most of them are in Kolebu. 80% of these dialysis patients are in Kolebu, which, as a comprehensive strategic plan that we want to do, chronic kidney cases, it's not only dialysis, and I want to repeat it here. It's not only about dialysis. It's about prevention, early detection, early treatment of the underlying causes, which are mainly hypertension and diabetes.
Oh, is this in reference to the...
Yes, I'm coming there. Dialysis. And people do dialysis waiting to have kidney transplant and rehabilitation. There are 6 major things, which we as a committee member, as government, we are looking at it holistically. Okay. And our candidate will come out to give you what we have for not only chronic kidney cases, but for
other
also
chronic
diseases. And to me, not everybody who is on kidney, you see the numbers who are in Kolebu are just a tip of the iceberg. There are people who are in my village or in some village who has kidney problem, but he doesn't know where to go. Indeed. So that with Agenda 111, we will put strategic dialysis machines.
But let's deal with the NHI issue, because then if Kolebu, Tamale, and all the other hospitals where dialysis take place were on...
Tamale was not part because they brought us all their figures.
Okay, right. Then, I mean, do you worry that after you had taken a good plan for the patients, the resulting communication didn't go around well for instance, Kolebu to start giving services to patients?
I don't blame Kolebu, and I'm not holding brief for Kolebu. As I said, it takes a few days for these policy statements to be well documented and written by Kolebu. Because Kolebu management has to write.
I don't think the problem is Kolebu, because Kolebu were waiting for the communication from the National Health Insurance Authority.
Yeah, so maybe health insurance delayed. Maybe if I'm also holding brief for them. Immediately the statement came out on, I think, Saturday, isn't it? Or Friday. It came out on Saturday, on the first of Saturday. Immediately it came out, and it became, they should have maybe sent the letter to them immediately on Monday morning, or even if I'm the one, I will have sent the letter on Friday. I agree with you.
Let's wrap up on the health insurance issues.
But they will get their refund. So
they will get their refund.
I can assure the patients that anybody who falls within that bracket and who has paid money for dialysis will get refund. So if a major, who is their president, he called himself, is major, is listening to me, he should tell them that everybody should calm down, that it's a policy. The money is there. And the Kolebu will be, and the other hospitals will be refunded.
I'm sure they are happy to hear that they will get the refund. But the categorization, there are people who have raised questions about the categorization, that people within the 1859 age group are only getting 2 sessions. And even in the case of Kolebu, it's just a 50% subsidy. I mean, what went into that thinking? Yes,
you know, when you want to do something and you don't have all the money to do the thing, the first people that you have to look at is the vulnerable group.
Okay.
So the vulnerable group in this case are the children and those above 60. So National Health Insurance, from their own corporate social responsibility fund, decided that they want to add something to also alleviate the plight of the people within the age of 18 to 59.
Right.
And they said that, okay, let's give them some, some 2 sections so that they can also be relieved. So that's what they are doing. And I know that they have 8 sections, a minimum 8 sections. Some even have 12 sections. But that's why I said that dialysis per se, if you're a billionaire and you're on dialysis for 10 years, you become a pauper. And that's why...
This is only for 6 months. Is there a future where we would put this, specifically
there's a future.
On the National Health Insurance Scheme?
That's why I say that our candidate, His Excellency, the next president, Dr. Bawumia, will come out of a very comprehensive statement what you want to do when God's willing, He was given the chance.
I'm happy to hear that we are looking into chronic diseases. I just hope that we can have time to, understand what work is going into studying the increasing cases of chronic diseases like liver disease and all that in the country. But when we come back, we'll look at other aspects of insurance and then move into other areas. Don't go away. Well, thank you so much for staying with us here on Hot Issues. Still with me is Dr. Nsiah Asare. He is Presidential Advisor on Health. We've been having an insightful conversation on the health sector and some projects that he in particular has great knowledge of and in charge of. Is it? Right. Thank you so much, Doc. Let's talk about the recent standoff at the ports when we had very important medical equipment and medicines coming in for HIV, AIDS, people living with HIV and AIDS and tuberculosis, and yet there was this standoff for a long time. I mean, what really happened?
Yes, it's an unfortunate situation. I've been a Director General of Ghana Health Service before, so I know about global funds commodities which come into the country. Normally, when they are coming, we get to know about it.
Right.
Then you have to prepare yourself to clear them for the ports as quickly as possible. I got to know about it very late. We started working on it seriously. We are still working on it. I don't think all of them have been cleared.
That's true. Yes,
which we are still working on it. Because if you leave things in the port for a long time, it will create damages. That's where the problem is. And I say every time that damages are payment of inefficiency. If you are inefficient, you pay damages.
Right. So the person who's cost us this much in damages and port charges, is that person still has a job?
I'm not too sure. I'm not in the Ministry of Health, but we are finding a solution to it, and I think it has reached a stage where it's of the Ministry of Finance, because you see, this country is governed by law. So there's law on the exemptions. There's tax exemption regime, but there's a complete act on it which you have to pass through. Sometimes it becomes difficult. Sometimes you tell yourself that why should there all be these laws and all this, but you have to follow it. A GRA personnel who is at the port will not release anything if he doesn't have the authorization.
True.
Ministry of Finance is not the people, they are not supposed to be the people who will also exempt. Ideally, it's Parliament. So I'm saying this so that Parliamentary Select Committee on Health and Parliament should also try and also come in so that they all assist for the rest of the goods to be cleared.
To be cleared.
I mean, this is not politics, but this is pure
health
issues. And to me, health is not politics. So I will clear it, and hopefully most of the things can then get to where they are supposed to, because I just heard that they've cleared the malaria goods. That's what I've heard. I think what is left is the TB, and I think the HIV, some of them have also been cleared. So I will get the TB drugs to the people so that if we are not very careful, all of us will have MDR, that's the resistant TB. and it becomes a problem. You are just walking, and there's somebody who has it, will then infect you.
It's a public health threat.
It's a public health issue. It's a threat, and I believe that anybody who is listening to me that is supposed to do something about it should just sign the paper and let us move on and clear all of them from the pot. And to me, I was also a bit sad when I heard it for the first time from the Global Fund representative in the country. That's the reason why we started working on it. We are working closely together with the Ministry of Health and then also with the Ministry of Finance to make sure that we get it out.
Doc, what's the status of our routine vaccinations? There was a time when the country ran out of vaccines and then we got a measles outbreak.
Yeah, now I know that we have managed that one, and I think there's no shortage of any vaccines. And going forward, that's the reason why we want to manufacture our own vaccines, because we cannot always depend on people to bring us vaccines, even if it's in the country, and we are buying it ourselves. We buy some of them from the factories which are doing the vaccines. We will be paying in cedis, not in dollars, because we also have some support from Gavi. And we also know that Gavi on 31st of December 2029 will also be transitioned out. So we are preparing ourselves very well so to be able to be like what Nigeria is doing, South Africa is doing.
I see.
But I can say that for vaccination, we've done very well in EPI, Expanded Program Immunization. We should not let
That's
it go
good to hear. That's good to hear. But while we're on the subject of vaccine, we've had, the issue with AstraZeneca on the global market. They have pulled out. But prior to that, we heard about the blood clotted issues. Are Ghanaians at risk of these fatal blood clots?
No, if you get the blood clots, it's immediately after the first dose. And most Ghanaians took the...
Is that the case? There are people who, months on, got the blood clots and they have traced it back to the AstraZeneca they took in the US.
Oh, I think maybe they were predisposed to blood clots. You see, let me tell you something. AstraZeneca has withdrawn AstraZeneca COVID vaccines, not purely because of the complications, but because of market.
But we don't expect the corporate organization to admit that we are withdrawing it. After you've given it to millions of people, we are withdrawing it because of so and so. And let's not forget. They didn't
talk about the black cloth.
They didn't talk about it, but previously.
Yeah, but
no, Doc, hang on. Let me make the point. Let's set it up so that you can respond to that. Previously,
yes,
they had admitted to the fatal blood clots that their vaccines could be causing those. Months on, they decided to pull, and the reason they gave at the corporate level was because they were, it was a marketing issue indeed, that they didn't think that their product was fetching them the money they needed, they were putting into the cost of production. However, we know that in the height of COVID, the UK stopped using AstraZeneca for medical reasons. And those same AstraZeneca were pushed over here. So my question is, are we at risk as Ghanaian people who took AstraZeneca wholeheartedly?
No, we are not at risk. That's why I say that if you get it, it's mainly after the first dose, a few weeks after the first dose. So if you didn't get it during that time, it's not likely. Okay. You see, when you look at risk, for example, I always say that drinking water is also you are at risk. You can choke and die. Anything that you take into your body, which is foreign, has some complication, but you weigh the benefits against the complication. That's what is done every time by the scientists. And when we weigh it, we know that it's good for us and then move on. But as I said, AstraZeneca have withdrawn it not because of the complication, but mainly because of marketing. If you are making millions...
Are we still giving AstraZeneca in Ghana?
I think most of the vaccines, COVID vaccines you have in the country are Pfizer. So if they've withdrawn it, we also withdraw it so that you won't get AstraZeneca to buy again.
Oh, I see, yeah. I see. Let's talk about a place that you were head of, Konfanoche Teaching Hospital.
Yes.
You were chief medical director there. Is that a position?
Chief executive. Yeah.
Chief executive officer, indeed.
Apparently the longest.
The longest chief executive director, chief executive officer for Konfanoche Teaching Hospital.
Yes.
I see. But you have really gone through the ranks, because I know you were at the district level too.
Yes,
manning facilities.
It's also at Tamale.
Indeed. So let's talk about Konfanoche Teaching Hospital, right?
Yeah. The
doctors recently were sent out of their homes. They didn't have accommodation. Because of that, they threatened to strike. What do you think about that? It's a shame, isn't it?
It has been sorted out in a way. But I think it was a misunderstanding. They were not sent away from their homes. I heard that a private developer has bought that area and he wanted them to move. But they've sat down with the private developer. If I'm a private developer, I will always be threatened that I want to come and take my property and put up my buildings. But they've sorted it out and there's no
wait,
problem.
so where the doctors live is not government property?
You know, there were government areas which like here in cantonments and also in Accra, where it has been also been given out for private development. So that's how it happened.
So
But
government sold off where the doctors live before it could provide them new
I don't know who
accommodation.
sold it, if it's government or is the
But if
is
it's
the chiefs.
but if it's government property, the chief couldn't have sold it unless
Yes.
government had reverted the property or the land back to.
Yes, I think the government reverted the land to the chiefs. And the government was putting up blocks of flats for them, which were not finished. They didn't finish enough, early enough for them to move in. And then the developer, Nsiah, was also waiting. But I see the problem was that the developer was dealing directly with the doctors who were residing there. But the chief executive quickly came in and took it upon himself and then negotiated on behalf of his doctors and everything.
But would the right thing have been that alternative accommodation was found for the doctors before they were, evicted?
If you give land back to chiefs, and they are in a hurry to maybe to also give it out to people to come and develop. So they were not evicted per se, but the private developers were threatening to come and evict them. But as I said, it was amicably sorted out.
Doc, thank you for coming. This is all we have time for.
Yeah, thank you.
I appreciate you talking to us.
Thank you very much.
And thank you too for watching us today on Hot Issues. I'm Nsiah Asare and I've been sitting with Presidential Advisor on Health, Dr. Nsiah Asare. We hope to see you same time next week here on the program. Until then, bye-bye.